know if I'm perimenopausal or menopausal?
Okay, so by definition, menopause means not having a period at least for 12 months. So you'll always have to look back to know whether you have gone through the change or going through the change, because it's a point where you have to look backwards rather than going forwards. So the last period, you will never know it until 12 months have passed it to know that. So the time uh, between the time the hormones change or fluctuate quite a bit to the time when you have your last period is called perimenopause. And for most women, it happens 3 to 5 years before they have their last period. So it could be quite a turbulent period in that time. And that's when most women have the most symptoms as well. So it's perimenopause. And the average duration for most women to go through the whole change is 47 to 55. So at some point, it's going to happen. And in UK, the average age is 51. South Asian women have it earlier than that. So there are ethnic variations to that.
So if there's a patient who's, say, 46 years old and unsure if they're perimenopausal, can they get a blood test to diagnose the perimenopause?
That's a very good question, because I hear that a lot. A lot of women come to me asking for hormone tests to see where they are in their transition. The most women do not need a blood test, or the blood test is not reliable for most women. That's because when the estrogen and progesterone, the hormones, are fluctuating, the levels change on a daily basis. So there is no one single normal level that will guide as a clinician to say whether you're going through the change. That's one big reason. The only place for doing the blood test is where very rarely when somebody is having what we call as premature ovarian insufficiency, where the periods have stopped before the age of 40, or some very rare hormonal disorders, we do the hormone test. But having said that, if somebody is going through them very early, we may do blood tests, but not for the female hormones as one is expecting, but maybe doing other tests to see whether the thyroid is fine, the iron levels are fine, because a lot of symptoms that are perimenopausal and menopausal can be with a lot of other problems. So there is a lot of overlap in the symptoms with other conditions. So we may do tests for those, but not necessarily for the menopause.
If I am perimenopausal, do I still need to be on contraception?
Yes, most definitely yes, because perimenopausal means you still have some ovarian activity left, and although the chances of pregnancy are very, very few, we can't rule it out completely. So you do need to be on contraception. And hormone replacement therapy, although we are giving the estrogen and progesterone, which is also in the contraception, it is not in the same level or the quantity or the type that will act as contraception. So women who are perimenopausal, even if they go on hormone replacement therapy for their menopausal symptoms, they need to have additional contraception in the form of whatever they choose to be. So it could be long-term options like coils or implant or injection. So there are a lot of options. So they still need to continue that as well as hormone replacement. Sometimes there are some contraceptive options which will do the job of one of the hormones in hormone replacement, which is the progesterone. So, for example, if somebody has a Mirena coil as contraception, it will act as the progesterone component for hormone replacement. So, we just replace the estrogen part, not replace the other half. So, there are exceptions to that.
So I'm in my mid 40s. I'm not sure if I'm perimenopausal or not. What symptoms should I be looking out for?
So, estrogen receptors are present throughout our body. So, contrary to what a lot of people think that menopause means hot flushes, it is not the whole story. So, there are multiple symptoms, and according to the British Menopause Society and International Menopause Society as well, there is a list of symptoms. The common list is around 37. So, you're looking at multiple, but they say that there is no symptom that you cannot attribute to it until you have had a check and a chat with the woman. So the symptoms most women notice around perimenopause or period changes. So this is the first thing that's going to happen for many women who still have periods. If they're on contraception that allows them to have period. So the periods can become irregular, they can come early or late, they can become heavy. So that's one thing. The other things, they may start to notice that their sleep pattern has changed. Maybe they're not sleeping very well. Either they're waking up because they're feeling hot, or they wake up and they can't get back to sleep. So they could be sleep quality and the duration may change. Sometimes they come with symptoms like aches and pains in the joints, stiffness in the morning, frozen shoulder, Achilles tendonitis. All these changes happen because estrogen again is a hormone that has a key role in producing the collagen and elastin, which keeps our joints supple. So deficiency of that or reducing levels of that will impact the joints and muscles. Other main thing is fatigue, mood changes, which may include irritability, feeling anxious. So women come to me saying, I used to do this so easily before, but now I'm overwhelmed doing the same thing, and I don't know why it's happening. Brain fog, forgetting things like short-term memory issues or word finding difficulty. Again, those are the things that most women notice. Um, but the good thing is these things are more um, noticeable around the perimenopause. That's when your body is noticing the deficiency of estrogen. But over a period of time, the body adapts, and there are adaptations made in each and every part of your body, including your brain, your muscles, your ligaments, your tendons, and bones. So things do improve. So the average, again, duration where these symptoms are known to last for is 4 to 7 years, but nothing is written in stone. Some women breeze through, may not experience many of them, or may have only few of them, but some may have it persisting for much longer than that. And that's why it's important to make the women feel she is listened to and understand, rather than putting it down to, okay, you're 60, so you're way past the time, so you may not have symptoms, because that's not the case. There are some women who much later continue to experience these symptoms.